When a company like Mayo Clinic's mission is to inspire hope and contribute to the health and well-being, we're not only talking about patients, we're talking about an entire economy. The Valley has benefited greatly from the impact that Mayo Clinic has made through partnerships, jobs, research, education, and much more. Please help me congratulate Mayo Clinic as the 2012 Impact Award recipient in the category of Economic Driver with over 250 employees. Accepting this award is Dr. Wyatt Decker, CEO of Mayo Clinic in Arizona.
Well, thank you very much, members of the Greater Phoenix Chamber of Commerce, for this wonderful acknowledgement of the work at Mayo Clinic. I'd like to start by thanking some who are with us. We have over 5,000 employees at Mayo Clinic here in Arizona, and we're fortunate to have not only a representative of our employee base that help make what we do possible at the Mayo Clinic, but leaders from the community and who are members and supporters in our leadership council. So thank you to all of you for making Mayo Clinic possible. There is a certain irony in a not-for-profit organization receiving the Economic Driver Award. And I'd like to speak to that, and I'd like to speak for a few minutes about Mayo Clinic, who we are, and how we can help move the state of Arizona forward. Mayo Clinic is the nation's first and now largest integrated multi-specialty medical group. Nationally, we have over 58,000 employees. We came to Arizona 25 years ago, and we'll be celebrating our 25th anniversary on June 29th this year. During that time, we've grown from 40 physicians to over 450 physicians, and we have grown from a modest campus in Scottsdale to a large multi-site presence in both Scottsdale and the city of Phoenix. Yet today we face such incredible challenges in healthcare, and it's hard to open a newspaper or listen to the radio without hearing something about healthcare and the healthcare challenges that this country is facing. We're spending over 17% of our gross domestic product on healthcare. We're told that that's too expensive to sustain. That's over $1.7 trillion, or $7,000 per man, woman, and child. And we at Mayo Clinic take great pride in providing the highest quality care that can possibly be provided. And the question that all of us face in this room, throughout Arizona and throughout the United States, is how do we continue to pursue excellence in clinical care at a rate that's affordable for this country and for our economy? Well, what I'm here to share with you today is to tell you that it can be done and we can do it. We do not have to lower the bar of quality of care in this country in order to make it sustainable, but it will be a challenge. The Dartmouth Health Quality Institute, an independent institute, of course, based in the Northeast, was analyzing healthcare costs, and they realized that the Mayo Clinic model of care costs Medicare patients 30% less, and that if that model were adopted nationally, we would save approximately $500 billion in our national healthcare costs across the nation. So how will we get there? How will we move the dial? How do we continue to improve quality of care, yet make costs affordable? Well, let me tell you about one small initiative that we've launched here at Mayo Clinic in Arizona through partnerships that are making a difference, and it is our telestroke network. So many of you are familiar with the hospitals in outstate Minnesota. I'm going to use Kingman Regional Medical Center as an example, outstate Arizona. We have Kingman Medical Center. Kingman has patients, like all emergency departments do in regional hospitals, with acute strokes. They don't have access to a neurology consultation for decision-making on clot dissolving or thrombolytic medication. It has to be administered in the first 3 hours. So rather than Kingman Medical Center having to hire their own neurologists that would be very difficult for them from a business perspective, we partnered with Kingman and 9 other hospitals around the state of Arizona to make available 24/7, within 2 minutes, a Mayo Clinic stroke expert who can work with their family doctors and emergency doctors to make a decision on giving clot-dissolving medications. We've already intervened on over 100 stroke patients and have had excellent outcomes, outcomes that wouldn't be possible without giving those clot-dissolving medications. This model of care reduces costs and improves outcomes, and it wouldn't be possible without a partnership. And so we see going forward at Mayo Clinic a very bright future for healthcare and a bright future for healthcare in the state of Arizona. And it will continue to be an economic driver. So the healthcare industry in the state of Arizona grew 3 times faster during this past recession than the national rate of growth. And I did say growth. So the healthcare sector continued to grow, and it grew 3 times faster in the state of Arizona. So we have an incredible opportunity at Arizona to pull together across all of our communities within the state and do something very special within the state. This wouldn't be possible without partnerships with our visionary leaders, and I'd like to thank Mayor Stanton and Mayor Jim Lane of Scottsdale for partnering with Mayo Clinic and other healthcare providers and education experts to say, how do we do this better? We have forged a partnership with Arizona State University to say, how can we leverage all that great expertise at Arizona State University to help us solve some of the healthcare problems that we face, not only here in the Valley and in the state, but nationally. And we believe, and we have a strong sense of optimism, that Mayo Clinic, in partnership with ASU, with Valley healthcare providers, including entities like Phoenix Children's Hospital and Scottsdale Healthcare, and with innovative research arms such as Translational Genomics Institute, we can do something very special here in Arizona. What will that mean for us in Arizona? It will mean we will unequivocally establish Arizona as a national and international center of excellence for healthcare and for the biomedical sciences, for innovation, for business startups, and for care of patients. We are currently, as many of you know, under construction for a state-of-the-art proton beam facility on our Phoenix campus. This is a $180 million commitment to our region that will be the only cancer center treatment of its kind in the state of Arizona. It will create 130 high-tech jobs, including physicists that are being both trained here in the state and are being attracted from around the world. And it creates 500 construction jobs during its construction phase. As important as all of that is that it will help to create a nidus of excellence and excitement that will raise the awareness nationally of what Arizona is and can be in healthcare as we move forward. We are in the fundraising phase of launching a medical school, which we feel is badly needed for the state of Arizona. Our medical school, in collaboration with ASU, will be the first in the nation to include a master's degree in the science of healthcare delivery. So for the first time, there will be medical students not only educated in excellent technical care and compassionate care, but for the first time in the country, there will be medical students, doctors, being trained in how to engineer healthcare systems for better outcomes at lower costs. And this wouldn't be possible without the partnership with ASU. As we move forward, we see a bright future for healthcare in Arizona, and we love the can-do spirit, the roll-up-your-sleeves, get-it-done attitude that we have encountered for the past 25 years, and we will look forward to a long and bright future here in Arizona. Thank you very much.